Hi, this is Tambar from Chicago Arthritis. Today I want to discuss a patient that I saw recently who I think has an interesting clinical scenario that is really relevant to a lot of patients that we see in the clinic on a regular basis. So this is a gentleman who is a recently retired professor who has a history of pretty bad pseudogout, which is basically a condition that causes a lot of inflammation in his joints. I saw him specifically for a chronic left ankle arthritis condition. I saw him roughly 2 years ago originally. So he'd had this condition of pseudogout for a few decades and had developed a lot of chronic damage in his left ankle joint. And when he came to see me, he wanted to learn to see if there was any other regenerative medicine options that could help him with his pain and function. So 2 years ago, we treated him with his own bone marrow-derived stem cells, specifically into his tibia-talar joint as well as into his subtalar joint and some of the ligaments around the ankle as well. He had a pretty good response actually. I'd originally told him that he was a challenging candidate due to the level of his arthritis, but he ended up having roughly a 65 to 70% improvement in pain for the last 2 years, which led him continue to cycle. He actually went on a trip to Machu Picchu and was able to hike up there. So he did actually quite well given the degree of his arthritis. He came back to see me now because he's recently retired and starting to push his activity level again and has been having some more pain again. So looking at his MRI again, our approach this time is going to be injecting his own bone marrow-derived stem cells into his ankle joint and ligaments again, but now also we're going to end up treating his talar bone. In his bone itself, there's evidence of swelling and some inflammation within the bone. What we've come to realize over the last few years is that treating the bone in an arthritic patient can actually give a longer lasting degree of pain relief and more pain relief than if you only treat the joint and ligaments. So it's an interesting thing because number one, he's a patient that's had a pretty good response despite his existing level of arthritis, something that a lot of people are surprised by. Number two, we're actually trying to do better than we did last time. I would say getting a 70% response rate in his clinical scenario was actually a really good result, but I think it's worthwhile trying to do even better for him by treating the bone this time around. Which brings me to my last point, which is I think really one of the more exciting and great parts about being a physician and practicing regenerative medicine is the fact that we're always trying to do better. Yeah, it's great that this guy had a good result, but the science is changing, the techniques are improving, so much so that we want to continue to grow. I think as a physician, there's few things more satisfying than being able to help somebody and professionally understanding that we can continue to grow and do better. So hopefully he gets an even better response than he did 2 years ago. Love to hear your thoughts. Let me know what your thoughts are on growing as a professional, in particular if you're a physician, and as a patient, how you feel if your physicians are shooting higher and higher as well. Thank you for your time and look forward to talking to you later. Bye-bye.